Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. Today we're going to learn about the disease called multiple sclerosis, a disorder in which the body immune system attacks the protective covering of the nerve cells in the brain, optic nerve, and spinal cord. My guest today is Dr. Natasha Hameed, a neurologist at Northwell Health. Dr. Hameed has expertise in multiple sclerosis, epilepsy, and other neurological conditions. Dr. Hameed, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you for having me. Glad to be here.
So tell us first a little bit about you. What made you want to focus on neurologic conditions?
So my interest in neurology kind of stemmed back to when I was in med school, so especially during neuroanatomy. I think that's where it kind of started from. So being able to do, dissections and, kind of study the brain and hold the brain in my hands was really fascinating. And then, of course, just the neuroscience portion of it. And, there was something about neurology that just really sparked my curiosity. So that's kind of where I started. The whole neurology interest kind of started back then.
Excellent. So I talked a little bit briefly about multiple sclerosis and other kinds of disorders that you are focused in on with the brain. But just give me a brief definition of multiple sclerosis. What is it? And,
Sure.
Tell us a little bit about that.
Sure. So you very correctly described it earlier. So what we understand about multiple sclerosis, it's an autoimmune, immune-mediated disorder of our central nervous system, which is our optic nerves, brain, spinal cord. It's basically where our immune system kind of becomes dysfunctional and makes mistakes. It starts attacking and causing inflammation, brain and spinal cord, and causing demyelination, which is the destruction of the myelin sheath, the protective coating around our nerves. And when it does that, it basically disrupts and impairs electrical signals that go from one area of the central nervous system to another, and then hence causing multiple sclerosis.
So I hear there are two types of MS. What are they?
As far as subtypes, I would divide it into three main subtypes of MS. The large one being the relapsing form of MS, which affects about 80% of the MS population. And it's basically when patients have recurrent attacks, relapses that last for 24 hours and, can completely recover or partially recover. And it's a portion of these patients where relapsing MS can develop secondary progressive MS is when, they could still have the clinical attacks, but then they still have this, continuous disability progression over time, independent of relapses. And then the last subtype, which is the least common of the three, is the primary progressive MS, which usually occurs in less than 20% of the MS population. So these patients generally don't have the clinical attacks or clinical relapses that we commonly understand in MS, but they have disability progression over time. So, it could be gait, cognitive progression. Patient could start off with using a cane, and then over time, a walker, end up becoming wheelchair bound. But the disability is basically independent of relapses.
With multiple sclerosis, I know it's autoimmune, and one autoimmune disease disorder. What can we do, or can we do anything to prevent it?
So in the last 2 decades or so, the FDA has approved over 20 different treatment options. So there's, like you mentioned, there's no cure for MS, but the treatment that we've had and kind of been studying over the years and still studying are, aimed to prevent the progression of the disease, as far as, preventing new relapses, progression of the disease, new spots in the brain and the spinal cord. So that's basically where, research has led us today.
So what are some of the risk factors? Is it familial? Does it run in families? How does this show up?
So yeah, exactly. There's no exact cause for MS, but we believe there's a combination of both environmental factors and genetic factors that predispose individual for developing MS. So as far as genes are concerned, we probably have over 100 genes that have been identified as being associated with MS. Environmental factors, one that a lot of us commonly know about is the, sun exposure, vitamin D deficiency. So the further away you are from the equator, the less sun exposure, the more vitamin D deficiency. So those patients are at a higher risk for developing MS. And then we have our popular viral hypothesis. So we believe there's probably, maybe a virus that individual becomes infected with, that leads to the immune system being triggered and leading to attacks. And, more recently in the last, there was a paper out of Harvard from last year, which kind of supported, it kind of proved the viral hypothesis on EBV, which is the Epstein-Barr virus. So that's, as being one of the leading causes of MS, although it does not prove that it's a cause of MS, but definitely there's some link or association there. And then, of course, smoking has been linked to the development of MS, and possibly like obesity and diet as well.
Well, some of those things that you mentioned are preventable or at least treatable. Have you seen any resolve after some of those elements that you just described being treated? Have you seen any resolve from MS?
As far as resolving, again, when patients get diagnosed with MS, we have them supplement vitamin D. Right. We have them, go on to like a healthy diet regimen. Mm-hmm. We have them stop smoking, but I wouldn't say it resolves the disease process. It maybe controls it to a certain extent, okay, but it doesn't cure the disease. It doesn't reverse things.
What are some of the common symptoms?
MS can cause a whole host of symptoms. So it really depends on where in the central nervous system that MS attacks. So, for example, it could, you could have issues with the vision. It could be vision loss, blurry vision in one eye, perhaps both eyes, which is rare though. They can have double vision. They could have facial pain that we call trigeminal neuralgia, facial weakness that, people term as Bell's palsy, troubles with their speech, and more common. And, troubles that we have are the, motor and sensory. So, weakness, trouble with their gait, gait balance issues, numbness, tingling in their extremities. It could also have bowel bladder dysfunction, mood. So depression, anxiety can actually not only be a comorbidity in patients. And one of the most common symptoms that we hear about in our daily MS clinics is fatigue, which could be one of the most debilitating symptoms.
Have you seen any MS come from people who serve in maybe the military, who maybe are exposed to chemical substances in the environment? Have you seen any connection with that in your studies or research?
Not that I know by far. There's probably, like I mentioned, there are probably environmental factors out there that could potentially be risk factors as well. But not that I have knowledge of as far as research is concerned.
So how do we diagnose this MS?
So there's really no one test to make a diagnosis of MS. So we rely on, a couple of different, parameters. So one, of course, is our clinical history. So making sure we're getting a good, history from the patients as far as, what their clinical attacks have been over the years. A very thorough neurological exam can help us kind of find, deficits on their exam as far as vision, balance, sensory loss that can help kind of point towards where in the brain or spinal cord they may have like inflammation. And I think one of the most essential tests is actually the MRI imaging. And back in the days when they didn't have MRIs, they were basically relying on clinical exam and physical history, but now the MRI scans has really revolutionized how we've diagnosed with MS. And lastly, we have our spinal tap, which according to new clinical criteria, it's not always needed. So you can still make a diagnosis of MS without getting a spinal tap in an individual. And according to the criteria, we're looking for symptoms that patients have had over a period of time, affecting different areas of the central nervous system, and separated in time. So we call it dissemination in space and dissemination in time. So they have to meet that criteria in order to diagnose MS.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about multiple sclerosis, a disorder in which the body's immune system attacks the protective covering of the nerve cells in the brain, optic nerve, and spinal cord. My guest today is Dr. Natasha Hameed, a neurologist at Northwell Health, who has an expertise in multiple sclerosis, epilepsy, and other neurological conditions. So when do these symptoms actually show up? What age, typically?
Yeah, so on average, I would say it's probably in their 30s, but patients can present as early as their early teens to as late as like 60s. But majority of patients, when their initial diagnosis is between 20s to 40s.
And what is the common or current treatment for multiple sclerosis? I know it's tiered in terms of medication and
so no cure, but it's there. So I like to characterize it into two. So we have one is the treatment that focuses on the disease process that we call a disease modifying treatment. And then two is, treatments that focus on symptoms. So symptomatology, for example, fatigue, the pain, spasticity, which is muscle cramping. So that's separate side of the treatment. But, most of our research to date, has really been focused more on controlling the disease process, the disease modifying treatments. And we have over 20 different treatment options in our toolbox to date. So, these medications not only, control the inflammation, they prevent clinical attacks, and also, to a certain degree, they control the progression of the disease as well.
And how are you choosing the right medical regimen for people who come to you with multiple sclerosis? How do you make that differentiation, if at all?
So yeah, it can be a little tricky, especially with all the options we have. But I usually take a lot of factors into consideration. So, one of the most important ones for me is patient preference and what works for their lifestyle. So, there's some patients that have a certain preference as far as not wanting to do a certain type of treatment over the other, or being reluctant regarding certain side effects that a medication have. So, the options that we have for treatment, they range from we have injectable options, we have pills that a patient can take, we have infusions that they would come to an infusion center to get medication. So, for some patients, they clear out, tell me that they, don't want to do injections. They don't want to have to inject themselves, once a week or 3 times a week. And, some patients, for example, they're, say, traveling overseas for, business or personal reasons. They don't want to commit to coming into an infusion center once a month. So, patient preference and what works for the lifestyle is important. Of course, their comorbidities or other medical illnesses they have, if they have a high blood pressure, diabetes, liver, kidney issues, that needs to be taken into consideration when choosing what drug we want to put a patient on. For a certain medication, which is called the natalizumab, we look for and check for antibodies to a virus called the JC virus, which can potentially cause side effects in a patient if the patient has started on that medication. So we test for that. So those are just things that kind of help determine what medication a patient goes on. And it's always important once a patient is diagnosed to start them on treatment as early as possible, because it has shown to decrease the progression of the disease. And in the more recent era of MS treatment, we are focusing more on starting patients on the more highly effective treatment up front. So, we do have over 20 options, but, the efficacy scale differs. So we have the low efficacy, we have the moderate efficacy, we have the high efficacy, and starting patients on the higher efficacy medications, we call more potent medications, does seem to improve outcomes better.
So when you say high efficacy regimen, what does that include?
So those are, we have infusions, we have an injectable that's high efficacy too. So basically there are drugs that, kind of work, from many of them work directly on breaking down the B cells, or preventing T cells from entering into the brain. And causing direct attacks. So they're basically more effective. And, the studies have shown that, because of all of the clinical trials that they have done to study these highly effective treatment have been compared to some of the older drugs. And they have shown that, these medications are more effective in preventing relapses and also slowing the disability progression as well.
So with multiple sclerosis, do you also focus in on lifestyle modifications for basically as it relates to nutrition or any kind of behavior modification and lifestyle of activities of daily living? How comprehensive is your approach to multiple sclerosis in relation to that?
So yes, definitely. So it's always a discussion I have during one of my first visits with my patients, my newly diagnosed MS patients. And, of course, we're doing our part with, the disease modifying treatments and the drugs that are, controlling the disease process. But at the same time, we know that, lifestyle modification in conjunction with our treatment shows more benefits. So, of course, the things that I, kind of review with patients, smoking, we definitely counsel them on, quitting that because that has been linked to a more progressive and more active disease. In patient with MS. Diet, I do, counsel patients on, following a healthy diet regimen. Of course, there's really not one diet that's, best for MS. So, I tell patients, follow a diet which is, has a balanced diet. You want to make sure you're incorporating vegetables, fruits in your diet, staying away from processed food, added sugars in your diet, because that can definitely kind of, indirectly affect your immune system. And of course, exercise. I, highly, highly encourage exercise for our patients as well, even if it's just like, 30 minutes of just walking a day or going to the gym once or twice a week. So highly encourage exercise. And, that not only helps an individual physically, but also, mentally in our patients with MS as well. And then I also have patients add vitamin D to their multivitamin regimen as well.
So would you say your patient population is mostly what age? 30s, 40s? Have you ever seen an onset in older adults? What is your population?
So majority of them are, I would say, 30s, 40s. So I see a lot of newly diagnosed patients. And I would say for me, at least they average somewhere like at maybe 35. It's very rare for new onset MS to present after the age of 60, but I have to say that I personally diagnosed at least a few patients around the age, but it's pretty rare. Like new onset MS after 60 is very rare.
Is there one symptom that a patient will describe maybe over the phone or meeting you first contact that you would ultimately say, this probably sounds like to me multiple sclerosis? Is there any particular clinical manifestations that a patient may have or complain of having that you would say, what, let me look because this sounds like multiple sclerosis?
So that's hard. I mean, I feel like there's no one symptom that could confirm a diagnosis of multiple sclerosis. We have to really take, maybe if they've had previous attacks in the past. Right. Because a lot of the MS symptoms, if you think about it, could be symptoms of another disorder or maybe another autoimmune condition. Mm-hmm. Sure. So, for example, diabetes, patients with type 2 diabetes, type 1 diabetes could present with numbness, tingling of their extremities, which could also be a symptom of MS. So we have to really take a lot into account and, evaluate them, get a better history, see if they've ever had attacks in the past, and probably get an MRI scan. And if the MRI scan with the symptoms is suggestive MS, then you could make a diagnosis of MS for sure.
You're listening to Your Family's Health on the Voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about multiple sclerosis, a disorder in which the body's immune system attacks the protective covering of the nerve cells in the brain, optic nerve, and spinal cord. My guest today is Dr. Natasha Hameed, a neurologist at Northwell Health, who has an expertise in multiple sclerosis, epilepsy, and other neurologic conditions. So, Doctor, what do you think in terms of the resources available to patients with multiple sclerosis and their families? Because this, I know, is very involved with the whole family dynamic.
Right. I mean, I feel like it's not only a disease of the patient. I mean, of course, the family is always impacted here. There's several resources. I usually connect patients to the National MS Society, and they have good like, outreach systems, outreach programs they could reach out to. I personally refer all my patients to physical therapy, occupational speech therapy as for a functional evaluation when they're first diagnosed, just to kind of get an idea what their deficits are and kind of understand their body and understand their disease a little bit better as far as what therapies or what exercises they could do to kind of on a daily basis to kind of compensate for their deficits. So a lot of resources out there, and I get to kind of share that information with the patients, especially for the newly diagnosed patients.
So with multiple sclerosis, does it affect every system in the body?
As far as the direct immune attack, it
Yes.
only affects the brain and the spinal cord. Of course, it can indirectly, impact, our bowels start moving a little more slowly, so patients can be a little more constipated, like bowel bladder dysfunction could occur. They could have, of course, the sensory symptoms; those are still neurological symptoms. But as far as organ involvement, it's predominantly the nervous system.
It's mostly the nerve system. So bowel, bladder, that's what you'll see. So the late stages of MS, describe the clinical picture there for someone who has had MS for many years.
Yeah, so I guess it's it's variable because, late stages of MS or someone who's had MS for maybe 30, 40 years, if there been a mild case of MS, they may be able to completely function independently and live a completely normal lifestyle. But if we're thinking about someone who's had more progressive course, you could expect someone who may be wheelchair bound or have more tightness of their arms and legs, and maybe some cognitive symptoms as well. But MS is definitely a hard disease to prognosticate and predict what's going to be out there in the future. And of course, no two patients of MS are alike, so you cannot really compare yourself to other individuals with MS. But it really depends on what disease course you've kind of been through over the years. I have a lot of patients who maybe in their 60s have had MS for several years and are still working, functioning independently. So it really depends on what the course of the disease has been.
In terms of getting in touch with you, if someone was interested in, maybe had a loved one or someone that was thinking that they needed to reach out to someone who specialized in this area, how do we contact you?
Sure. So my information is on our Northwell website as well. I guess if you just, if someone wanted to kind of look into, just Googling multiple sclerosis specialists in Long Island, it may show up, but, the National MS Society, our program has been recognized as a comprehensive multiple sclerosis center. So we are listed on the National MS Society website as well.
So if someone wanted to get in touch with someone who's maybe talking about behavioral modifications, that's all on that website and all of it's inclusive there at that one place. Yes.
There's a great information on that website.
Okay, so we thank you so much for being a guest with us today. And we just want to say, Dr. Natasha Hameed, a neurologist in Northwell Health, thank you for educating us about multiple sclerosis and other neurologic conditions. We appreciate all of this information and we hope you stay healthy. Is there anything else you want to add to this information about multiple sclerosis that you think we left out that someone would want to know?
The only thing I would add is that it is an exciting time as far as MS research is concerned. So, maybe in another 10 to 20 years, how we treat MS and how we care for MS patients is probably going to be, different. We're going to have a lot of improvements. We are looking into treatments that are focused more on our progressive MS patients. So currently that's something that's lacking as far as treatment. And we're also looking into therapies for remyelination. So correcting, the myelin damage that was lost from an attack. So exciting things to look forward to. And we're on the journey.
That sounds wonderful. Sounds good. So we thank you. This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And we want to thank you, audience, for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.